Good morning, and thank you for joining us today for the Sustainability Reduce Risk with Intelligent Hospital-Grade UVC Disinfection webinar. My name is James Collins. I am the Senior Director of Business Development at CSBA, and I'll be facilitating today's webinar. Before we get started, I want to take a few moments and make a few quick announcements. If at any time you have a question for presenters or a technical issue, please use the questions tab of your GoToWebinar dashboard. If you do not see the webinar dashboard, it may be collapsed. Look for an orange arrow in the top right corner of your screen. Click on that arrow and it will expand the dashboard. And at this time, I would like to introduce our presenter for today's discussion, our partner, R0's president, Eli Harris.
Wonderful. Thank you for having me, James. All right. Thank you all for joining us today. It's a pleasure to be here. These events have been very successful for us in the past, and I think I have as much to learn from you guys as you do from me. Just a quick background on myself. My name is Eli Harris. I'm one of the co-founders of R0. My background has always been in engineering. I actually spent 10 years in mainland China. I worked at the US Embassy for a while, and then I got involved in technology and worked on drones. And then I started my first business manufacturing large battery packs. Ran that for 5 years and was fortunate and sold that company in 2019. I came back to the States and was actually teaching at my old public high school. My public high school in California, Santa Barbara Unified School District, they actually opened an entrepreneurship academy. So it was really fun. I got to join, and I think it's awesome that a public school opened an entrepreneurship academy, and I got to teach and help build that program. And when I was teaching, the pandemic happened, which changed my life greatly and my role at the school. And at that time, I got in touch with two mentors of mine, both entrepreneurs, very seasoned, very successful, and we launched on this journey with R0. At a high level, we started talking about how there were certain events throughout history that create everlasting changes in infrastructure in society. In a dark way, we kind of likened what was happening with the COVID-19 pandemic to 9/11. And after 9/11, we now have the Department of Homeland Security. You have TSA with 22,000 agents. You still can't take a water bottle or wear shoes through the airport. You go to a sports game, you walk through a metal detector. These are all new standards that were developed around security that were all created and adopted post 9/11. And some of that psychological scar tissue after 9/11, it accelerated the creation and adoption of those standards, but we never regressed. And I think that the COVID-19 pandemic is going to expand that word security to biosecurity. And fundamentally, the world is going to take on a new posture for how we regard and respect human health and safety as it relates to facilities and all shared spaces and all public spaces. And I think that the pandemic also exposed just a larger awareness of human health and how pathogens affect society. 40 million people a year get the seasonal flu. 21 million people get norovirus, E. coli, staph infections. A fun fact I recently learned, staph infections actually kill more people than Parkinson's, emphysema, HIV, and homicide combined every year, which is absolutely unbelievable. So we learned through the pandemic that there are a lot of issues, but when we take actions to ensure safety in facilities, and we do things like wear masks, social distance, and the lockdown, which we hopefully will never have to relive, we actually do see a reduction in sick days. So there were very few cases of the seasonal flu in the past year because of the actions we took to prevent COVID. What we did is we started kind of dissecting what the disinfection industry looks like today. And what's crazy is that the disinfection industry, I mean, it's hundreds of billions of dollars in market cap, and it's governed by these massive players, Ecolab, Clorox, Diversey, SC Johnson. All of these companies are worth hundreds of billions of dollars, and they all sell commodity chemicals. And the industry has never evolved. In 1940, Clorox was selling bleach. Today, they're still selling bleach. And our response to the pandemic was to go around and pick up chemicals and go hose buildings down and go hose them down with sprayers or wipe them down. And this is really just absolutely archaic and antiquated. Using chemicals are wildly inefficient. It takes a lot of manpower and a lot of time. It's awful for the environment. It's incredibly dangerous for the staff, and it's all very manual. Not to mention, these chemicals actually only address surfaces. They have nothing to do with the air. And even as you're going around addressing surfaces, it's all manual, so there's a lot of human error. I mean, we're all humans. You have only one night and limited staff to turn over often millions of square feet of real estate in the district. You can only do so much. So we started thinking about, why is there not a better way to disinfect? Why hasn't this industry evolved? And what actually are the best tools that exist today? And why are they not more widespread? So we got in touch with Dr. Richard Wade. Dr. Wade actually is the former executive director of OSHA, and he actually joined us as our chief scientist and a minority shareholder in our business. And what he did is he led us on a study to understand, what do hospitals do today that's actually effective at disinfection? Thinking that ever since the advent of the hospital, that's a place where you actually encourage sick people to gather, and you have to learn how to control the spread of disease. And Dr. Wade led us on this study of UVC light. And UVC is actually extremely old technology. In 1903, the Nobel Prize was awarded for the discovery of UVC and its germicidal properties. The 1910s, we started using UVC in wastewater treatment. The 1920s in HVAC. Some of you guys may actually have UVC in your HVAC today. In the 1940s, we started using these towers in hospitals. And what's fascinating is that it's a $5 billion market today, and almost every single hospital in the country uses these UVC light towers to disinfect operating rooms in between surgeries. And it's a $5 billion market, and nearly every single hospital in the country uses this between every surgery and every operating room. And why we've never seen this, and the reason it's so successful is because over the past 80 years, there's an overwhelming body of evidence that shows that hospitals that use UVC lights have 93% fewer infections than hospitals that don't. So there's an overwhelming body of evidence. There is no pathogen on the planet that is UVC resistant. It disinfects air and surfaces. It will kill any virus, bacteria, mold, fungi. There is no organism on the planet that can resist UVC light. It's just a function of light and time, and that is it. Why we've never seen this outside the hospital, it's actually an artifact of our healthcare system. So this is crazy, but Medicare and Medicaid do not reimburse hospitals for hospital-acquired infections. So if you go to a hospital for a surgery and you leave with staph or C. diff or something totally unrelated to your surgery, that's a $40,000 liability for the hospital. So what's happened is, because there's such an overwhelming body of evidence that these systems do in fact prevent infections, the manufacturers, what they do is it's called value extracting. It has nothing to do with what it costs to build these systems. They come into the hospital and they say, hey, we're going to sell you this system for $125,000 because if we prevent just 3 infections, it pays for itself. But it has nothing to do with what it actually costs to build these. So we're all engineers, and with Dr. Wade's help, we actually went out and we raised $60 million from the same backers of Tesla and SpaceX. So we have the same engineering and manufacturing prowess from Tesla and SpaceX. And in 5 months, we went out and we re-engineered a system. And we built a system that unequivocally, fundamentally outputs more germicidal UVC light than any product being sold in the world today. And we're pricing it based off the bill of materials not extorting value from the healthcare system. So this was groundbreaking. I mean, it's the hardware. It's not rocket science. UVC light is extremely old technology. There's an overwhelming body of evidence for now 80 years in hospitals about what is effective. So we built a system that outputs more light. We did that with some unique design patents, but really it's just we have more bulbs in there that are higher output. So we actually sent the product to a US military third-party lab. It's called Biosciences. It's a DoD sanctioned lab. And we actually tested our system against live pathogens, live human coronavirus, MRSA, E. coli, feline calicivirus, SARS. We have a whole litany of tests which are published on our website. And we proved that we did different tests at different distances, different times. We do in fact have higher kill rates than any product sold in the world today. It kills everything in the air and on surfaces. And in 7 minutes, we can do 1,000 square feet to a 4 log kill of any pathogen. 4 log means 99.99%. In just 7 minutes, you can disinfect the entire air and all surfaces. And it's entirely autonomous, so there's 0 human error. What's really fascinating, or I guess I'll get this in a second, but we designed this to be extremely easy to use. We learned that most of our staff is English second language. There's very high turnover. There's not much formal education. So the device is extremely simple to operate. It's on 4 locking casters all the way to the base. It's very easy to move around. You wheel it into the center of a classroom. You press a button, and it will run based on the size of the classroom. It'll run a 4, 5, or 6 minute cycle. And in that time, it will essentially sterilize the room. It will disinfect all the surfaces and all the air. And it's a 4 or 5 minute cycle. There's only 4 buttons. There's an on and off, a start and stop, and up and down. And like I said, we built a piece of hardware that is darn good. And from a price performance perspective, it is the most effective product in the world, unequivocally validated by third-party tests, and we've priced it affordably. Where we actually innovated and built the entirety of our IP, which I think it's really interesting for you, is we're the first company ever to embed a Verizon LTE chip. And what that does is, while the operation is all entirely manual, you wheel this around, you press a button, and it runs. We transmit data in real time to a web-based app that you can look at from any phone, any computer, anywhere in the world. And what it does is you can actually see who ran it, what time, and what room. So in real time, you can see, okay, classroom 17 was turned over at 9 o'clock last night, but the teacher's lounge was missed. So for the first time ever, you actually have execution compliance and visibility into this process that's historically been invisible. Because right now, the common practice is to send your crews out, you go around and you clean, disinfect, you spray buildings down, you wipe things down, and you manually sign a log. Or if you're really fancy, you might scan a QR code, but there's no way of actually validating what was done. So with this system, there is 0 human error. It runs the same cycle every time. It is entirely autonomous. It treats air and surfaces. There are no chemicals, so it's environmentally friendly. And then you have a real-time audit trail. So you can actually see what's happening in real time. You can filter these reports by campus, by room, by operator, by day, by week, by month. You can cut up this data any way you'd like. And like I said, the ability for UVC to kill any pathogen, it's simply the amount of light that you emit and how long you run it for. So the cycle time is a function of the square footage of the room. But what we can do is we can actually pre-program your entire district floor plan into the device. So all the operator does, they just wheel it around and they select the room they're in and they press go. And then based on the room they select, it's already calibrated to run a cycle time based on the square footage of that room. So if you wheel it into a bathroom, it might run a 3-minute cycle. A classroom, a 5-minute cycle. Into the cafeteria, it will automatically know to run a 10-minute cycle. So it's automatically calibrated. So we take out all the guesswork from the operation, and then that data capture happens in real time. So this is the first time ever that we're able to create an audit trail around disinfection. And the value of that, there's a few different values. One is that you actually have compliance. So you can make sure that your staff is doing a good job. The second thing is marketing. If you want, you can create custom reports with limited access, and you can show that to teachers, to administrators, to parents, whoever you want. And you can restrict access. You only have to show them what you want to show them, but you can show people, hey, here's proof that there was hospital grade disinfection done before this event, or whatever it is that you want to demonstrate. And then the final thing is, to be honest, we live in a very litigious society, and we've already started to see an insane amount of lawsuits from both teachers, from staff, from parents, actually suing schools and districts, saying that, hey, there was negligence in your protocol, you're not doing the right job cleaning, disinfecting, there was a lot of human error. So what you can do with this is you can set a protocol, and then you actually have proof that the protocol was completed without any human error and no negligence. And that stands up in court if there's ever a lawsuit. So you actually have that audit trail to cover your liability. We're winning largely on cost savings. This is undoubtedly more effective than any chemical use. This is wildly more effective treating air and surfaces, much higher kills. And I wish people would do it because it's the right thing to do. But the truth is, it all comes down to dollar and cents at some point. And we're actually, how we're winning and why we've been so successful is that we've been able to fundamentally prove that this is actually cheaper than spraying. And the reason is that there's no labor and there's no chemical cost. So, I mean, of course, we're not trying to reduce your head count and your staff, but you can repurpose that staff for other projects if they're spending less time disinfecting. And what we've done is we've built what we call an ROI calculator, which is extremely data-driven. It's very clear, it's very robust, and you can input your floor plans, how many classrooms you have, how many janitors you have, what chemical you're using, how often you disinfect, and then you can do a very clear cost comparison for your facility on what it costs to maintain your existing protocol versus what it costs to displace that spraying and wiping with an investment in these UVC systems. And we can help you and walk you through that and help you build that. So we've been extremely successful. I mean, we are a startup. We are very well capitalized. We raised $60 million from the fund of Tesla and SpaceX. We manufacture entirely in the US. Our manufacturing is in San Jose, California. And then all of our customer service is US based, and all of our offices are US based. We are through and through a US company. We have partnerships with many different buy boards, GPOs, Spur. We're also deemed an energy efficient product because UVC light is actually extremely energy efficient, much more so than MERV rate, than upgrading your HVAC. Because when you do a higher MERV filter, you actually have to increase the power of the fans, which uses a lot more energy. So we have a lot of partnerships in the space. We've done $20 million in sales in the last 6 months, largely in the education space and in the medical space. And we've also done a lot of county jails. And it's been a really exciting first year. I think what I'll do actually before I talk about this, I have just a 1.5 minute video that I will play that just shows kind of the device physically, the operation, how it moves, just a quick 1.5 minute video. and then I'll talk a little bit about the future, just 2 or 3 minutes, and then we'll open it up to Q&A. So you might recognize the voice in the video. It is yours truly. So here we go. Fundamentally, R0 is UVC lights on wheels with a timer. We built this product with empathy for the end user. And as part of that process, we really tried to understand who is the average housekeeper, who is the average janitorial staff member on a school. And we built this with a low center of gravity, with 4 3-inch locking casters that all make it very easy to move. You don't need to hire any additional full-time laborers. It's your existing janitorial crew, and this becomes part of their toolkit. And they go around and they manually clean a space per their normal protocol. And at the end of that cleaning, they wheel this in, they press a button, and it runs a cycle. UVC light is harmful to human skin and eyes, so we really over-engineered the safety features. There's 360 degrees of motion sensors that operate day and night, and if there's any movement whatsoever, the device will shut off. We've also included an accelerometer, so by any force of nature, if there's any movement on the device, it will also pause. And all the data capture is happening on the back end, so the operator doesn't have to interact with any of the fancy technology. And that data capture is automatically pushed to a dashboard so the facility managers can, from anywhere in the world in real time, monitor the usage of the device. All right, so that was an introduction to our flagship system, ARC. I just want to, before we open it up to questions, I want to just take a couple minutes, talk a little bit about the future and where I think this industry is going. I do think we're going to see a huge movement into software, and especially creating audit trails and building on that compliance aspect. And where we're actually going as a company is we're gonna, in the future, start outfitting buildings with sensors. And they're very, very cheap sensors. They cost really just cents. But what you can do with these sensors is it's infrared data. It captures no privacy data, but you can actually see where people go in a building. You can see which rooms were used in certain amounts of time. So what we can do with that is we can automatically inform workflows based on usage and risk, not time. So if nobody used that conference room, don't send your crew to clean it. If 10 people use that bathroom, it doesn't matter if it's been 2 hours or 2 days, send somebody in there. So in real time, you can collect data on how spaces are used, and you only use your staff to go to the areas that actually need cleaning. You don't have any labor redundancies, and then you generate real-time reports on what was actually done. So it's pretty exciting. I think that we're going to see a lot more technology being implemented into the janitorial space. And I think what's really exciting is that I think we've already proven in the last year that these measures do impact risk and do impact illness. So we're currently working on a study with Clark County School District in Las Vegas, Nevada. And what's really exciting is this is actually, we're doing this study together with Harvard, and we're actually implementing our solutions. And over the course of a year, we're actually going to look at sick days because schools, as you guys know, are funded based on attendance. So if we can create healthier buildings and actually do more effective disinfection, and we reduce sick days, that's increased attendance. And what that actually means is increased funding for the school. And then there's also a lot of data out there that shows that attendance is also directly correlated to student performance. So if we can do a better job disinfecting, that actually results in increased attendance, which is funding for the school, and that results in better student performance, which is more funding for the school. So not only will better disinfection result in more funding for schools, it also is fundamentally changing the performance of education in our entire next generation of children. So it's a pretty exciting opportunity. I think that we're going to see that facilities management is going to become one of the most important fields of our lifetime. I really do believe that. And I think we have a serious opportunity to actually impact sick days. And I think the result of that is going to be financial as well as productivity and just a better future. So thank you guys for joining today. I know that was a lot of information. I hope it was useful, and I'm happy to answer any questions. We are here to really be partners. We're a double bottom line company. That first bottom line is we need to be profitable enough to operate. That second bottom line is social impact. So like I said, we manufacture entirely in the US. Our services here, our offices are here. We're extremely sustainable in our supply chain, and we really want to do good and democratize access to these hospital-grade technologies. So we're happy to come on site and do demos for your staff. We found that demos are effective. When we come on site in your facility, people get it, it clicks, it's easy to use. The janitorial staff like it. The value add is very, very clear. So we are very happy to come on site and work with you guys, and we want you to be successful. We can help you figure out how many units you need, what your protocol is, how to reduce risk, how to train your staff. We'll come do white glove delivery. We'll bring all the products on site. We'll uncrate them. We'll remove all the trash. We have English and Spanish training. We'll be very hands-on, and we have 24/7 customer support. So we really are here to do good, and we want you guys using the system, and we want to be partners, and we'd be happy to schedule any follow-up meetings or demos. So with that, I will take any questions.
Our partner R0 and Eli Harris. I do want to add this though. A lot of people don't know me either. I've been with CSBA for a short amount of time, but my background is in technology and helping Fortune 100 and Staples build out their technology needs. And so whenever we were working together and I saw your product, I knew immediately it was super innovative, and I saw the future of what you were doing. And so I know that we have attendees on this call, but I just want to let those folks know that this is a super innovative product, and I'm pretty sure you'll hear more about it as time goes on. So we're kind of on the front, we're on the front of it. But we will now enter to the question and answer segment of the webinar. You can ask questions using the questions tab of your GoToWebinar dashboard. We will try to answer all your questions today. So I do have some, Eli, that have come in, and you've kind of addressed it, but I'll ask the question anyway. So how do you think this product will impact education?
Yeah, I mean, so I think what we're going to prove with Clark County, which is amazing, and I think is, and with Harvard together, is better facility management will fundamentally change student performance. And the value of that for our country is unbelievable. That better disinfection practices and better management of facilities can actually change student performance for the entire country. In doing so, we also generate more funding in the education system. And if we can do that, that will change the responsibility of all facilities managers in all education environments in the world. So I think that this is going to be landmark. Yeah,
I agree. Are there any safety issues related to people being in the room while the machine is running, while R0's machine is running, like damage resulting from UVC to the eyes and or skin? Is there anything from a safety perspective we need to be aware of?
Absolutely. So the CDC and OSHA do have permissible limits of human exposure. Our stance is that nobody should ever be exposed. Long-term exposure will cause damage to human skin and eyes. The reason UVC is harmful to people is because it works. Like I said, the sun produces UVA, B, and C. Those are slightly different wavelengths. UVA and B penetrate the Earth's atmosphere. UVC is a longer wavelength, and it never made it to the Earth's surface. So the sun produces it, it does not make it to Earth. And because of that, nothing has ever evolved to resist it. So what happens is that wavelength can penetrate the cell walls of any organism, and it ruptures the DNA. So like I said, it will kill any virus, bacteria, mold, fungi. It can also penetrate human skin and eyes. So it is extremely effective. So nobody should be in the room, but we output a lot of light, so it's very short cycles. A bathroom, probably 3 minutes, a classroom, 6 minutes. And then we have 360 degrees of heat and motion sensors. So if anybody opens the door when it's running, it will automatically pause. And there will be a red light up top. It will tell you cycle paused, and it will also push to that app, cycle paused. And then you can resume it. So those heat and motion sensors have a 60-foot range, and every 1/8 of a second they're sensing. So it's actually the safest form of disinfection, because you can ensure there is 0 human exposure. Whereas with chemicals, there was a record number of deaths and critical incidents this year, because you can't ensure that somebody won't do something stupid with a chemical. Whether they eat it, drink it, put it in their eyes, whatever it is, you cannot stop somebody from making that mistake. Whereas with UVC, you can stop somebody from interacting. So how we're seeing people use it is, you still have to clean. This thing doesn't mop or vacuum. It doesn't mop, it doesn't vacuum, it doesn't take out the trash. So you clean, you send somebody in, you take out the trash. If there's a spill or dirt, you mop that up. And then instead of spraying or wiping, this is a replacement for spraying or wiping. So you clean, you wheel this in, you press a button, and it runs a 5-minute cycle. And while it's running that cycle, you're cleaning the next room. So, and then by the time you're done cleaning that room, you go back, you get it, and it follows your janitorial staff from room to room. So it does add a couple minutes on top of cleaning, but it's extremely less time. It's much less time than actually spraying or wiping down a room.
Got it. Let me see. Another question here is, does R0 provide systems for the HVAC?
So we are building installed assets, which we're going to launch in several months. But the HVAC systems actually are not a good way to do it. And the reason is that it's all local in the HVAC system. So you're still pulling sick air across the room. So you're pulling sick air over the students, through the students. And the other thing is that it's insanely expensive to retrofit your HVAC. A lot of schools were built in the 60s and 70s. To do a retrofit cost a lot of money. So what we're actually doing, which is incredibly more affordable and effective and is going to be the future, it's called upper room UVGI. So you install a UVC light on the wall, and what it does is it's an augmentation to your HVAC. It's not part of your HVAC. So it shines a beam of UVC light across the room from 7 to 10 feet. So it's a horizontal beam of light that covers the entire room. Then as you breathe, the air is hot. The air you breathe out is hot, and natural convective currents in real time, as you breathe, you breathe out air and it comes up, and it disinfects that air in real time in occupied rooms across the room. And it's significantly cheaper than retrofitting HVAC. So that is the future. Yeah.
Awesome. What is the difference between bipolar ionization systems? Is ionization, what is the difference between bipolar ionization systems? Does this sound familiar to you?
Yeah, bipolar ionization. So I think we're going to see a mass recall of these systems. They produce ozone, and there's a lot of there's been a lot of studies recently, especially actually in education, and I can follow up with you, James, on these later. but bipolar ionization, it can be effective at killing pathogen. It also can produce ozone, and a scary amount of ozone. So we're starting to see a recall of these systems. They are effective at killing pathogen, but there are some harmful byproducts. And again, needle point bipolar ionization is the big one, and again, it is more costly to do system-wide in the HVAC. So we evaluated that technology. There are some benefits. The risks are higher.
Got it. Here's a good question here. How many units would be needed for a school that has 35 areas to clean?
Yep. So the general rule of thumb, it's actually more based on your janitorial protocol. If you have a small elementary school and you have just one crew member that cleans the whole campus every night, you just need 1 unit. If you have a large high school and you have 3 folks that divide and conquer, then you would need 3 units, 1 for each of them. So it actually is more about how many active janitorial staff do you have during a shift in these spaces that you want to disinfect.
Got it. Once the start button on the device is pushed, how long does the operator have to get out of the room before the device begins?
Yep, so the default setting is 30 seconds, and we found that to be appropriate. That can be toggled on the back end if you wanted something different, but the default setting is 30 seconds. And if that person doesn't leave the room, it won't turn on because we have the heat and motion sensors. So if somebody were to press it and stand still and just stand right there, the device would not turn on.
Got it. Are the lights mercury vapor? And what is the protocol in the event of an accident if a light breaks?
There are trace amounts of mercury, less mercury than the fluorescence in your ceiling. And also, it's high output, low pressure mercury. Like I said, less than what's in your ceiling. The bulbs are recessed in aluminum reflectors. This whole system is aircraft grade aluminum. And because they're recessed, you can whack this thing and it will not break a bulb. At some point in time, I'm sure your staff will find a way to break it at some point during its existence. And when that happens, we will replace it for you and we will recycle the bulbs for you. That's part of our commitment as a sustainable double bottom line company. So we will replace it, we will recycle it. In terms of cleanup, it's less mercury than what's in your ceiling. You would follow the same protocol.
Got it. We may have addressed it, but I'll ask you, how large of a space does one arc cover?
Yep, so we calibrate all cycle times to a 4 log kill of any pathogen. 4 log means 99.99% kill. So when we give you a cycle time, it's to achieve that kill. The cycle time is directly a function of the size of the room. So a small 500 square foot room, so if you're in a 500 square foot bathroom, in 3 minutes, you can achieve a 4 log kill of any pathogen. In an 800 square foot classroom, it would take 6 minutes. In a 2,500 square foot cafeteria, it's 10 minutes. So the larger the space, the longer the time.
Got it. This is always a good question, but I feel like you've probably gotten this quite a bit. But why is your product best on the market? You've kind of gone through some of those highlights, but here's your opportunity to tell us why. Because we know there's other people out there, but to me, there's nobody else. So why is your product the best on the market?
We have higher kills in less time. The hardware is not rocket science. We built a system that unequivocally outputs more light than any product in the world. And what that means is we can achieve the same kill or a higher kill in less time. Because the ability for UVC to kill anything is light times time. So we have higher kill rates in less time, which is more efficient for your janitorial staff. And then what's extremely unique is we're the first company ever to have that LTE connectivity, so you get the real-time reporting. So those are the differentiators.
Awesome.
But fundamentally, I mean, it's the same technology. UVC light is UVC light.
Right. Yeah, that makes sense. How do you determine if UVC disinfection is necessary, and what does it make where does it make sense and where would it be overkill? I mean, you've kind of addressed the second part. Maybe the first part is how do you determine if it's necessary?
Yeah, no, I'll speak to both of those actually pretty quickly. So there is no silver bullet. There's nothing. I mean, the name of the game is risk reduction. There is no such thing as risk prevention. The more you do, the safer the space. I mean, you should do a combination of masks, distancing, good hand hygiene. I mean, if you could do something for the air and increase your air changes per hour, that's great. If you can open a window depending on the weather and where you are, that's great. That there is it is a layered approach. This is one tool. It's extremely effective. We've been using these in surgical rooms for 80 years, and the reason we do it is because it works. So the more places you do it, the better. There's also, if you think about where real risk actually is, it's not in the open air hallways. It's not in the giant auditoriums. It's not in somebody's cubicle. Where people are actually getting sick is in the high traffic shared spaces that are closed off. If you do any kind of contact tracing, if you look at any study, it's bathrooms. It's where people are eating. And classrooms as well have a high degree of risk. But more than anything, it's bathrooms, elevators, small spaces where people are communally eating, in classrooms. So I'd say if you have the flexibility, the best practice would be to run it in bathrooms a couple of times a day. Have your staff just go out periodically, do the bathrooms. If you can do the classrooms every night, that would be great. What you're doing is when you run this system, you're bringing that viral load down to zero. So what you're doing is you're ensuring that you start every single day with the lowest viral load possible. And the probability and severity of illness is directly related to viral load. So when James and I are in the room together, there is risk. When somebody else walks in the room, risk goes up. And throughout the day, that risk is climbing, climbing, climbing. And every night, you reset to zero. Climb, 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 reset to zero. If you didn't do that every night, then it would just continue to climb because we've learned that pathogens stay alive in spaces for sometimes days. So if you could do it every night, that would be best. If you can't do it every night in the classrooms because of limited labor, limited time, then doing it every few days. I mean, the more you do it, the better.
Got it. Last questions. Last one I have here is how do you recommend participants contact you to learn more about pricing?
Yes. So my partner that runs the entirety of our sales, his name is Matt McKee, and his email is matt at r0systems.com. Or Matt M. Let's put it in the chat. Brooke, can you put that in the chat? Matt M at r0systems.com. And like I said, I mean, we're here to be partners. We'll come on site. We'll do demos. We'll help you build protocol. We want as many people using this as possible because we fundamentally believe this is going to create fewer sick days, better attendance, better performance, huge cost savings, way more effective than chemicals, and environmentally friendly, and you have that reporting. So we're really excited to be here.
Awesome. And one thing I want to add to the participants, at the end of the webinar, a window will pop up in your web browser, and where you can add your name, email, and district /COE. We will share that information with R0 to contact you more about ARC and also the UV disinfection. So if you have additional questions, I know pricing is one of them, and I know it's one of those things where it's kind of a different, just depends, right? It just depends on what your needs are. And so I want to make sure that that's out there as well. But thank you to our partner, R0. And we're super excited for the partnership. And we just want to say thank you again for joining today's call. As you know, CSBA is dedicated to providing up-to-date resources to our school board members. And to view our recent webinars, be sure to check out our YouTube page at youtube.com/CSBA video. If you're interested in attending future CSBA webinars, please go to our website at www.csba.org/webinars. That's www.csba.org/webinars. www.sustainably.org/webinars to register for upcoming webinars. Today's recording and slide deck will be available to view on our webinars page by tomorrow afternoon. Eli, thank you so much for taking the time. I know you're busy right now, and we do look forward for the continued partnership, and then we will continue to promote this throughout our resources. So thank you so much, and you guys have a good rest of your day.
Thank you all.